cause, because no cause can be justified if it is done in a fashion of violence. Violence can never be justified. So I think while some of them are using that to promote their own interest and using the poor people, so some of them are sandwiched between the regime and those few people who call them Naxalites, and they have their own programs, whether and I don't want to say whether they come from one part of the country or another, they come across the border in our country. But yes, certainly they take advantage of the economic situation. So all we need to do is understand the problem and solve the problem by rule of law, and those who indulge in violence definitely needs to be taken to task, and let people feel that there is a government, there is a law-abiding agency, and at the same time you have to give them health care, you have to give them education, and you have got to give them employment, and you have to give them the security. So this is a very complex question, but I personally would tackle it in this way. I don't know if you want to add something, how would you do it?
Oh, I wish I had a solution.
You want to? No, there are no. It's a cause of concern. It's definitely a cause of concern, and somewhere down the line, I think everything boils down to economy. And if you see these areas where the problems are taking place are economically quite backward. They are tribal areas, and we need to understand their problems and address the problem in a civilized manner, and be strong on people who are taking advantage of these poor people. Second question.
Same question. I have several actually, but I want to monopolize. One is going to be health, non-health, coming back to entrepreneurship and opportunity. Second, can you give us maybe some bullet points, tips, if I should, sounding sort of practical here. Where could entrepreneurs and opportunities, people can go and make money in India right now?
There is one condition attached. One is I charge for collaboration.
Yes, back to you.
Austin has taught me that. And secondly, whatever money you are going to make, I need a percentage of that. The profit is ongoing. No, the tips are, if I ask you in a country like India, what is needed most by people? And I think one of the areas is really infrastructure. And you just can't go wrong. Today I was talking to Dr. Mahapatra from Quest. I said, if I have to go into business, any one of you go into that business, you have to share the profit with me. I'm with you. Is diabetes management center. Today, the cities have so much of money, and because of lifestyle, diabetes is a huge, huge, huge disease in terms of percentage. 17% of the population in India, they suffer from diabetes. 29% of the Indian population has hypertension, right? So if I start, let's say, diabetes centers at each and every corner of the city, and give franchise like you have McDonald's, like you have Pizza Hut, and if you have this diabetes management center and charge them a yearly fees, so they become members, they'll come very happily and get themselves treated, and all you have to do is just manage the lifestyle. So there are umpteenth number of things one can do. Please understand, India is today number 4 economy in terms of spending power. If you look at in terms of economy, in terms of the exchange rate, it could be 12. But in terms of PPP, the purchasing power is number 4. So here you are sitting on a huge economy. And it is tremendous as far as the spending power is concerned. And whenever I go to any place in a five-star hotel or restaurant in India, it's always crowded. So it's never a dull moment there. Marriages are huge in India. Marriage is an industry. It's a huge industry. Fashion is such a big industry. But talking about that fashion, you see, the problem is those people who manufacture the cotton in the western part of Maharashtra, Vidarbha, these people commit suicide, the farmers, because they don't have enough capital. And you have the same cotton which is displayed by pretty looking models, which all of us love to see them on the ramp. But it's the same cotton which is being displayed, which is being exported. So somewhere down the line there is some problem. That you have 9%, we have 9% of economic growth. Now it has gone down to 6%. But somewhere down the line it's not going down to the last man on the street. And that is where I think we need to fix the problem. And that is where there is a great opportunity, even at the village level.
Thank you.
Rest when I come to your chamber and take some money, then I'll give you the rest.
It's free for you.
We should perhaps just do 3 more questions.
Yeah, please.
I don't know if you noticed, I had to step out during your talk. It was actually to talk about your Leishmaniasis
To
project.
talk about?
Your Leishmaniasis project with the Institute for One World Health, World Bank. But I'm Steve Salmon. I'm in the Healthcare Management Department. And I don't know if this was addressed while I was out of the room, but I believe it was about 3 years ago, ICICI sponsored an insurance program for Indians farmers. And I've lost track of how that project has been going. And my question is the project underway? And if so, how well is it working?
You see, what government has now come, what is short form is narrator. And that is where 100-day work is guaranteed. Whether you have drought, whether you are unemployed, each and every family is guaranteed at least 100 days work. So his basic needs are taken care of. The problem with the farmer's suicide is the money lenders. And the rate of interest at times is so very huge and high that they are unable to repay. And once they are unable to repay, they get into a state of depression. And in the village level, there still is a value system that if you are unable to pay, then, you should be ashamed of yourself. The villagers have no idea about the American system where you can pay, billions and billions of dollars, you don't pay the bank. So they still live under that orthodox system. That my God, this particular person had taken $200 and he has not been able to pay. So nobody is going to get the daughters married to that house sort of thing. And that stigma is there. So the system is now to make sure that they have got crop insurance. And as far as the lending of money is concerned, now we have got the institutions coming into their help. And a lot of their loans which they have taken have been waived off as far as the institutional banks are concerned. So it is a multi-pronged approach. And as far as the ICICI scheme is concerned, it is still on but not very effective.
Thank you.
Yeah, so this is, how's the day in the life of Central Minister? Is it very hectic, or is Dr. Manmohan Singh very hands-on, or is your own vision which works?
My average sleeping time is 4 hours. And I answer my mails till about 2 a.m. in the morning.